Welcome. My name is Julie Wilcox. I'm Director of Recruitment and Retention for the College of Education, Health, and Human Services at Kent State. And thank you for joining us today. We're going to learn a little bit more about some research opportunities and things that are going on at Kent State with Dr. Angela Ridgel. For now, please keep yourself muted. And then once we go into the question and answer, I'll let you open yourself up and we will take some questions. But for now, I'll let Dr. Ridgel take it away.
All right. Very good. Well, thank you for joining today. I know it's a busy time for everybody, but spring is coming, so we're all feeling a little more upbeat, I think, with the beautiful flowers. So today I'm going to talk about how exercise can affect the brain. Mostly what I'm interested in my research lab in is more neurological populations. So we mostly focus on looking at how exercise can potentially help people with brain injuries or neurological disorders like Parkinson's disease. We've also done some work in multiple sclerosis, and we've looked at how exercise can help older adults, specifically, older adults who may have some potential memory issues. So I'm going to just overview a little bit about the brain and how exercise affects the brain, and then talk more specifically about what we do in my research lab, and then I'll open it up to questions. Okay, so as you all know, the brain is very complex. It has a lot of different neurons that have pathways to each other. And so there's a lot of potential for disruption of those pathways and damage in the brain, basically with age, with injury, or also with neurological populations. Okay, the brain is also an area that needs a lot of oxygen and a lot of nutrition. Okay, a good example of that is when we all don't eat, excuse me, when we don't eat very well, and we may have that kind of brain fog, or that feeling of just not being able to concentrate. Okay, that's because the brain needs a lot of sugar or glucose to be able to operate normally. So that's why you get that brain fog. And again, we need a lot of oxygen to make the brain neurons happy. And so when you go to altitude per se, and you start to feel a little lightheaded, maybe you can't concentrate, hey, that's because of the decreased oxygen at altitude. Again, if you don't eat well, if you're not getting a lot of good blood flow, you could have that brain fog. Hey, and we know that exercise specifically increases heart rate, it increases blood flow. And so there's a lot of evidence to support that not only can exercise improve, your heart health and your blood vessel health, but it also can improve brain health. Okay, because the brain needs oxygen, and when you increase your activity, you increase your heart rate, you increase blood flow throughout the body, it's important that you get a lot of oxygen to the brain itself. Okay, the problem is, of course, is when you have scenarios where there are disruptions in the neurons, for example, in a stroke. Okay. In a stroke, you actually have decreased blood flow to the brain because there's a blood clot in one of the vessels that goes to the brain. So with that, with loss of oxygen, you get damage to those brain areas where the blockages occur, and that's what causes a stroke. Okay. Another example would be in Parkinson's disease, which is my particular specialty. Parkinson's disease is a neurological disorder that is progressive, which means it progresses over time. We don't have any therapies or any treatments for that progression. The current treatments for Parkinson's disease are medication-based, but they just decrease the symptoms. They don't actually improve the progression of the disease. Another example would be multiple sclerosis. Okay, multiple sclerosis is a loss of insulation on the neurons, just like insulation on an electrical wire. Our neurons have insulation on them, and that insulation helps the nerve signal travel along the neurons much faster. So it allows us to move and to think very rapidly. So with MS, you actually get the immune system attacking that insulation around those neurons. And the result of that is that you get decrease in the ability of the signals to flow along those neurons. And you also get disruptions of pathways, so you can get muscle weakness, you can get tingling in the fingers and toes with loss of sensation for the sensory neurons. Okay, and depending on where the damage is, you can get different types of symptoms. So in light of these issues, we in my lab are interested in how can we use exercise or movement-based therapies to basically try to improve function, not only of healthy neurons, but more importantly, in neurons that are damaged, in particular in Parkinson's disease and in individuals with multiple sclerosis. So how do we do that? Okay, my particular interest, most of the work we've been doing is cycling-based research, because we found over the last 10 to 15 years that in Parkinson's in particular, that cycling, specifically high cadence cycling, or when your legs move very fast, can actually promote changes in the neurons in the brain that can improve symptoms of Parkinson's. Okay, so what we do is we bring people with Parkinson's into my research lab on campus, which is in the MAC Annex. And we actually have a special bike that we've designed over the last several years that we call the Dynamic Smart Bike. And this particular bike actually is a motorized stationary bike. And we can set the motor at a very fast speed, because we've shown that if you actually challenge the person to do something that they can't do on their own, so that you assist them to do this with the motorized bike, that you can actually get structural changes and functional changes in the neurons that will actually decrease the symptoms in those individuals. So what are we doing when we're looking at those types of studies? What we think we're doing is we think that we are actually promoting what's called motor training. So the nervous system has the ability to change over time and even in disease states. So what we think we're doing with our particular cycling exercise therapy is that input that we're giving the nervous system while they're cycling on the bike is actually promoting changes in those neurons and connections of those neurons so that they can decrease symptoms. So that's the kind of things we do in my lab. Again, we've also done work with multiple sclerosis. In particular, that work was not cycling based, but we did work with pool based water aerobics. And we did that because one of the issues with multiple sclerosis is that those individuals have a tendency to overheat when they exercise because of the disease. And when they overheat, then that makes the travel of the signals on the neurons even more disrupted. And so they get significant weakness and fatigue during that. So we put them in a pool. And as you know, water dissipates heat very well, better than air. And so the idea behind that was that we could keep their core temperature lower and they could do more intense exercise, get their heart rate up more, so that we could potentially promote those neural changes in the brain that I talked about in Parkinson's, while decreasing their potential for overheating in the pool setting. So that's the basis of a lot of the work that we do. What kind of students are interested in working in my lab? Mostly the students who are interested in physical therapy, occupational therapy. Obviously, these therapies are designed not only for patients themselves, but kind of the grand plan of this is to have some sort of therapy that we could roll out to physical therapists themselves. Okay, as a physical therapist, if you have some sort of therapy, potentially some sort of device, a bike that would improve the symptoms of your patients, then you could potentially market that and say, I have this therapy that's unique and works really well. So that's kind of the broad look at, why are we developing these types of therapies? Why are we interested in seeing if they work? So for physical therapists and occupational therapists, they're always looking for different types of treatments to potentially improve the quality of life and the function of the people that they're working with. So any students in exercise science are welcome to come work in my research lab. We have a course that mostly juniors and seniors take. It's called Individual Investigation in Exercise Science. And in that particular course, every faculty member in our program has a section of that, and we can register you for whatever section you are interested in as far as the faculty member's interest. So again, individual investigation, it'll come along later. And usually what we do is the students will have hands-on experience with individuals with Parkinson's. They actually will do the experiments. We'll bring the people in, you'll monitor what they're doing, you'll do the tests that we have designed to evaluate how their symptoms are improving. And then we spend a lot of time, talking about data analysis. How would you look at these data? How would you analyze them? We do graphing, and we also have a potential for students to present posters, not only at symposia and other types of symposia or talks on campus themselves, but we also like to take our students to national and regional meetings. In particular, we go to the American College of Sports Medicine meeting. Unfortunately, the fall one was postponed, but the regional meeting is usually in the fall, and the national meeting is usually in the summer. And a lot of our undergraduate students who are more involved in the lab have the ability to go to those events. So that's just an overview. I'm happy to answer questions from anybody.
There we are. All right. Thank you so much. So I've been putting some things into the chat, or at least I think I have. Okay. Some links. I know you talked about your lab. I believe yours is the motor control lab. So there, I put the link in for not only exercise science, but also the labs. The motor control lab particularly, just so that those of you joining can kind of go to those if you're online. And then also I just put the acsm.org in there so students can kind of see the organization that you're affiliated with. But not sure if our student who has joined the meeting has any questions. If you do, please feel free to unmute yourself and ask those at any time. You had talked a little bit about some of the research opportunities in the junior year, but they can come and obviously try out the different labs and do some research with folks earlier so that they kind of know which lab they want to choose, correct? Once they get to that junior level?
Sure. Yeah. I mean, I would suggest if you're not quite sure, the way we usually work registering for this course is that we do have a list that outlines what everybody does. And then we just ask the students to contact those faculty members and say, I'm really interested. A lot of the times I'll have students say, can I come and just observe what you're doing? And we can do that, to an extent. If they want to come and see an experiment, just observe, see what kind of equipment we have. We can certainly do that prior to when you register for individual investigation. And then individual investigation is usually juniors and seniors take it, but it's not, I often have a sophomore who wants to do it, then choose. So it's not required to do it junior, senior. You can do it anytime.
And the Intro to Exercise Science course is a class that all students will take that first year, usually in their first semester, and that should give a nice overview of all the different things that you can do in the field of exercise science. Obviously, I know a lot of our students are interested in things like physical therapy, occupational therapy, physician's assistant. Can you talk a little bit about working in a physical therapist's office, possibly, but not being the actual physical therapist? Do your students have to do extra training to do that? Like, how does that work?
Right. So you do, well, we have, if you do an internship, okay, obviously as an intern, you could go work in a physical therapist's office. As an employee in a physical therapist's office, they also have physical therapy assistant. Okay, but that is a credentialed program also. So if you wanted to be a physical therapy assistant, then you would need to go to one of those programs.
Okay. Which we have at one of our regional campuses.
Yeah, I mean, it is possible. I do know of physical therapy studios that hire exercise physiologists to work with them. Okay, so what you would do is you would not be evaluating the injury or what type of treatment the person would need. The physical therapist or the physical therapy assistant would do that. But you may be taking the individuals, once the physical therapist evaluates what they need, then the exercise physiologist would take them through that training program. So I do know of some local studios or therapy offices that would hire an exercise physiologist to do that exercise prescription and monitoring people through that therapy.
Thank you. I think we have a question. How early? Oh, I think we answered that. Yep, that you can get into the lab as early as your, probably second semester of your freshman year, after you kind of, get to know the faculty and kind of find out what their research is and how they're working. And it might not be every lab. I know I don't know, how many labs do you have? I think I've counted at least 10.
Right.
9.
Right. So what we do is each faculty member has one of those labs is based under each faculty member. And then some of us share spaces. For example, the strength training lab. The strength training lab is a combined lab. It's really overviewed. Dr. Kingsley and Dr. Jaitner kind of oversee the majority of that work, but all of us have access to that. So say, for example, I wanted to do a strength training study in Parkinson's or MS. I could use that space also. Again, a lot of the space is shared. We just have, some of us have other specific equipment, like Dr. McDaniel has the ultrasound. He has a space where that's a big piece of equipment, so he can sit there, and then he has the table available to be able to lie people down. So really, there are 5 people in the department that take students right now.
Thank you. So Rachel actually asked a question: what's the difference between lateral sclerosis and multiple sclerosis? And I have never heard that, so I'm excited to hear.
So she's talking about amyotrophic lateral sclerosis, ALS, right?
Oh.
Yeah, ALS. So Lou Gehrig's disease. You all remember the ALS challenge where they were pouring ice water on everybody, right? So ALS is actually a disease where you get the immune system attacking the motor neurons within the spinal cord. And the reason why this disease is so deadly is because, again, it's progressive like Parkinson's, but the motor neurons that they attack are not only the motor neurons that give motor signals to the muscles in your arms and legs, but they also give signals to the muscles that control breathing. Okay, so a lot of these people with ALS, and it is very progressive, it's very fast. They don't know what causes it, but the problem is it starts to affect your arms and legs, and then you become paralyzed. And then if it affects your diaphragm and your respiratory muscles in your chest, then you're not able to breathe. You'll have to be on a ventilator, and it just is very, it's a very fast progressing disease. Okay, so again, motor specific. Multiple sclerosis is, again, where the immune system attacks the insulation on the nerves, which is also called myelin. So multiple sclerosis could potentially attack the motor neurons, but it also can attack the sensory neurons. It also will attack the central nervous system neurons. So a lot of these people will have significant issues with cognition. So they'll have memory problems and other types of potential behavioral problems. So again, it's kind of attacking 2 different parts of the nervous system. Multiple sclerosis is not as progressive, and depending on what type you have, it could be what's called remitting multiple sclerosis, which is when you have periods of remission, just like cancer. So you feel good at certain points in time, and then there's some sort of trigger where you have issues. But again, it's remitting, and that's what most people have. So it kind of comes and goes. And again, it's not as progressive, and multiple sclerosis doesn't kill people very often. It just, kind of a chronic disease, and it usually manifests itself in weakness and sensory deficits. So good question.
That was a great question. Wow. So I'm assuming maybe, and Rachel, maybe, is that particularly, are you interested in working with that population? And I don't know if she doesn't want to unmute, but if you want to answer that, because if you do, clearly you have a person right here that can help set you up with that. So you're choosing the right field. And I do think, because I do our recruitment and our admission kind of work, I looked, Rachel is actually a fall 2021. So she is currently going to go into her senior year in high school. So she's got a year to prepare. If you have not already, please come visit us. Oh, she wants to be a physical therapist. So you will definitely be working with that group. Wonderful. So yeah, so definitely come check us out. Once we get back on campus, we do different events where you can come and actually tour the lab, kind of meet some people, kind of go with, if you wanted to, you can spend a day and do classes with everybody and go through like a freshman schedule if you wanted to, or just sit in on a class or two. We have a lot of students that have been asking to do that lately, which I think is really smart. I know I did that. It was easy for me because my friend was already at school doing the major I wanted, so I just went and stayed with her in her room and, followed her schedule for a day. But we can definitely set that up. Are there any other kinds of questions or things we need to throw out there about the major? I think it's very exciting. It's like a little maze when you go back in to see all the labs. You don't realize just how much is going on. I have noticed, and I think I mentioned this in Adam, Dr. Jantner's also, but always something going on. So there's always, doctoral students, graduate students, faculty members, undergrad students. There's always people. If you need to go and find anybody, just go hang out in the labs because everything's always going on. So
right. So this last spring semester, just to give you an idea of what we're doing, I actually had 4 undergrads in the lab, but with the graduate students, our lab meetings, we had to have them remote here, but we had 12 people on the Teams call for the lab meetings that we had remotely. So it's busy, but everybody gets a chance to do a lot of hands-on work. So that's pretty exciting.
And you had talked, where is it? Are there physical therapists or anything like that in hospitals?
Right. So physical therapy usually has 2 or 3 kind of wings. So there will be inpatient physical therapists in the hospital that will work with people who are currently in the hospital setting. That is not quite as common in standard hospital settings, but they do have rehabilitation hospitals. And a rehabilitation hospital would be, if somebody were to have a knee replacement or break a hip or something along those lines, they may go to a rehabilitation hospital or a rehabilitation wing of the hospital where they would go through that physical therapy, inpatient physical therapy for some period of time. In addition, you have outpatient settings that would be for people that have injuries that aren't related to some sort of surgery, athletic injuries. Those people would go to an outpatient physical therapy setting. And, those may be attached to the hospital, but they won't actually be taking hospitalized patients through the therapy. And then lastly, if you're interested in gerontology, a lot of nursing facilities, nursing homes, and older adult facilities will hire physical therapists to work with those individuals too. So that's kind of the 3 branches of where physical therapists will be in the setting.
And then I know just from experience with my nephew, there are, for the early childhood, like if you're not in a school yet and you need care, like I know he received, home care because he was an infant and he needed physical therapy, occupational therapy, and speech therapy. And I believe they were obviously contracted through the state, I think the Department of Developmental Disabilities, and or the county that he was living in. So you can work physical therapy, you can work with infants all the way up to older adults. So it's a great foundation that we have at Kent State that gets you that experience. I was going to ask, you talked about the patients that you bring in, or the clients, I should say, that come in with the Parkinson's studies and that sort of thing. How do you it's obviously community members, but are they referred to you? Are they all from one specific hospital? Is it more they find us and join? How does that work?
Right. So yeah, I've been doing this, for 12 years now. I am in connection with the local community. There are a lot of support groups in this area. In fact, I was on a board for a group that actually supported the support groups. And as part of that, my name was out there. So I actually go speak to the support groups regularly. We get IRB approval to give out flyers and talk to people about the studies that we're doing when we go to those. There's actually a pretty big community in Northeast Ohio regarding Parkinson's. We have the clinic and University Hospital. So these organizations have symposia, and that one of them was supposed to be here in April. They had to reschedule it for the fall. But these symposia actually bring in, the last one I went to had 300 people that came in to hear the speakers. And I always go and have a recruitment table there. So we get that. We also have a significant list in several of our IRB applications. We ask people if we can recontact them, if they've done one study, for them to come back. So most of the people agree to that. So we have a running list of people who have agreed to be recontacted. And when we're ready to do a study, we call them, let them know what it's about, and see if they would like to volunteer. So actually, we don't have too much trouble with it. I also I have several neurologists in the area that know my work, and I just contact them. They're happy to refer people also.
Wonderful. All right. Well, I see we are at a little past 12:30. So are there any last minute questions or things that we want to throw out there from many of our participants? I want to thank you very much, because this is, always interesting to me to hear about what our faculty are doing, but also the fact that it really touches, so many people, not only in our community, but the research is going to go worldwide. That was what I was going to ask. Have they actually put into place any of the research that you've done in the past 12 years? Is there anything that they're using out in the field yet?
So not quite yet, although I do have people, we've been doing this work for so long, so it's kind of getting out there. So people are trying to do the high cadence cycling, and their programs where they're doing that, in a community setting. The particular device that we're creating, we only have them on campus, but we do have 2 patents for that technology.
I thought I had heard that.
Yeah. And we are currently aggressively trying to get together with potential marketing partners and creation partners. Actually, I had a call this week. I have another call with somebody in Belgium next week. And the engineers that I work with at CASE are working with us as well. We've gotten several technology grants, so it's coming. It's very slow, and I have people asking me often where they can buy my device.
Yes.
You can't buy it yet. There's only one in my lab, but it's coming.
So Rachel has asked, what type of shadow opportunities should she or could she do her senior year? Like, are there?
Yeah, so there are many. We have many connections, particularly in physical therapy. Dr. Barkley is our internship coordinator, so he would be able to get you hooked up with physical therapists. I would suggest, if you are interested in the hospital setting, you can talk to me or talk to him. He can give you connections with people that you could potentially shadow. So it kind of depends on what field you'd be interested in. if you maybe wanted to do gerontology or pediatrics or inpatient, you should probably try to focus on that to make sure you like it.
Yes, that's always it's good to think about shadowing because yeah, I know that I share this a lot of times in person, so I'll share it now. I did athletic training for 1 semester and I thought, oh, this is going to be great. I loved the training room. Who knew? I really liked the physical therapy part of it. I did not like the acute injury part where I had to see people get hurt on the field and then immediately have to take care of them. It was way too way too medical. And then they're like, oh yeah, we're gonna do this and poke at them. I'm like, no, I don't want to do that. So yeah, needless to say, I got out of that right quick. But I didn't know that because I had never shadowed, and I would have known had I actually looked into it before starting the coursework that was really not what was for me. So it's always a great idea to go and shadow some folks.
Right, and then I mean, you have my contact information. When you get on campus, feel free to reach out. I'm happy to talk to you. You don't have to wait until later to come see me. I'm in my office and pretty approachable, so I'm happy to talk to you at any time.
Wonderful. Well, thank you so much for doing this, and I hope to see everyone in person sooner than later, but let's hopefully when the rain stops, it just started raining here, that we can get out and actually exercise and yep, get out and move. That's the one thing that everyone keeps saying, like we sit at these desks and do these meetings, we don't have to walk to a meeting anymore. So we definitely have to get up and move. So thank you so much, and we'll see you all soon.